Good afternoon and welcome to this month's show. I'm Luke McCormick. During today's show, we will discuss critical issues facing government and industry leaders in using information technology to improve healthcare and healthcare services. With me on today's show are Lisa Lewis Person, Chief Operating Officer, Office of the National Coordinator for Health IT, Pat Flanders, Chief Information Officer, Defense Health Agency, Captain Hassan Tedda, Warfighter Health Mission Chief, Joint Artificial Intelligence Center, Department of Defense, Bill Tinston, Director of Federal Electronic Health Records Modernization, Thomas Long, Director of Federal Healthcare, Verizon, Nick Saki, Principal Technology Strategist, Pure Storage, and Nicholas Svies, Chief Federal Technologist at Snowflake. Well, I love, as a former CIO, the conversions of IT with enabling the healthcare community. Very important topic. Lisa, we're going to start with you. Give us an example of the progress that's going on in this very important community.
So we've made great progress across the federal government. I'll specifically talk about what we have done in ONC over the last year. For those who don't know, the Office of the National Coordinator for Health IT is responsible for regulating the electronic health record industry. We coordinate across the federal government and with industry in regard to health information technology programs and policies. And we also are the federal agency responsible for facilitating interoperability of electronic health records, health information technology in general, and making sure that all of our health information flows in a safe and secure manner to where it needs to be when we need it most. And so we have done a few things over the last year. First, we published our Federal Health IT Strategic Plan. We worked with over 25 of our federal partners to put this strategic plan together. And so I want to thank all of our partners for that work. We also released our final rule. It's the 21st Century Cures Interoperability Rule. And both of those that rule and that document push us toward interoperability of health information. So the safe and secure flow of health information is critical to transforming how we deliver health care in America and ensuring better health and care for all of us.
Super important. I'm very happy to hear about the strategy as we really lay out this capability and be respectful and mindful to the security of these records as well. Pat, how about over at DHA? A lot of activity going on there. You all have really been on a journey over there to modernize that environment.
Yep. So, the most exciting thing going is our adoption of a commercial electronic health record. The name of that program is Military Health System Genesis. I don't run that, but in my area, I modernize the network. And with Genesis, it's a fundamental change because with our legacy systems that the EHRs are replacing, because it's a distributed system, it's all about local area network. Where with Genesis now, we're reaching back to the cloud, and we're wide area network centric. And so huge modernization there. We're replacing 4 legacy computer networks with one. It's called the Medical Community of Interest. And with that comes a host of security tools, standard VLAN architecture, and it's really helping enable Genesis and make us a lot more secure.
I'm sure in a modern environment, you really need to make sure you have a modern infrastructure to make sure those things are running top notch and being secure. So fantastic. Glad to hear the progress there. Captain Tedda, how about over at the Jake? A lot of activity going on over there. Give us an outline, give us an update as to how the program's going.
Thank you. Thank you, Luke. The program at the Jake is very robust. You mentioned activity, and my colleagues have talked about all the great things that are going on in their respective organizations. We are working with all of those organizations, including the folks over at DHA, to do the great work of transforming the Department of Defense by leveraging AI. Now that sounds like a very lofty title and lofty goal and vision, but under the leadership of General growing. We are exactly doing just that. We are leading AI adoption at scale. There are a couple projects I'll highlight as we go into this, accelerating joint AI capabilities. We're providing enterprise AI services, and this is across many different domains to include health, of course. And probably more importantly, and probably very exciting, is we're creating an AI friendly ecosystem, so that folks will be comfortable with using AI. Obviously, we are really at the intersection of where work, technology, and data and people kind of come together, and working with our respective partners, to include even the VA and our commercial partners, to bring to bear this exciting technology so it can actually help address some of the many challenges we have in healthcare and improve the provision of care that we deliver to our warfighters and their families.
Interesting angle with AI incorporated into the healthcare system. So we'll be eager to hear more about that. And we really do have a nice constellation of folks on this panel to hit all aspects, including the very important electronic health record itself. So Bill, tell us about what's happening in regards to the activity going on in regards to electronic health records.
Oh, great. I'd love to. So Bill Tinston, director of the firm. So the firm is, if you don't know, the organization that the Department of Defense and the Department of Veterans Affairs had the foresight to set up when they recognized that they sort of backed into a joint program with the deployment of the electronic health record in DoD and the deployment of the electronic health record in the VA, right? It's a single common record about the patient, not where the care is delivered or who delivered the care. So they looked around and said, hey, we need somebody to look across this whole space. They created the firm, and then I've been fortunate enough to be the director of the firm. So what we've accomplished, or what's happening right now with the firm, builds on what Pat talked about, what Lisa talked about, what Hassan talked about, and lots of other stuff going on, right? So the DoD side, Pat talked about MHS Genesis. The DoD side, a few weeks ago at this point, delivered Wave Carson. It was 150 locations. It was 12 states. It was a ridiculously complex implementation and rollout of the health record across a huge swath of the Defense Health Agency, and Pat's infrastructure was all there to support it. As we've been working with the DoD and the VA on the joint HIE, or Joint Health Information Exchange, we've driven the DoD from 14% interoperability with community care electronic health records to 65, and the VA from 30% to 65. A lot of that driven by what Lisa was talking about, the rules and the good work that the ONC does in getting standards in place. We've also started to implement the FHIR standards between the VA and the DoD, and we're working with the commercial health information exchanges to get them implemented there. And that just brings an incredibly powerful improvement in availability and usability of the data in the various domains that we're getting the data, so that we get the data that the provider needs for an encounter about a patient that's relevant, right? They can actually indicate up front what would be relevant. And because we're engaging these FHIR standards to get the data, we can bring that correct data back, present it in the workflow, and make the experience seamless to the providers and the users of the health systems that we're supporting, which at the moment is the Department of Defense, the Department of Veterans Affairs, and the Department of Homeland Security's Coast Guard. And I imagine there's opportunity going forward to bring other federal healthcare providers into the fold of the single common record as we go forward.
Those are some impressive stats there, and it's really great to see the whole picture come together, as you said, from Lisa all the way down, sort of pointing that North Star, giving you the infrastructure. And as the OMB CIO stated yesterday on the program, meeting the patients where they are, right? And I think that's really important. Which leads us to you, Thomas. We can't do all this unless we have some great infrastructure out there, some great capabilities from our partners to enable these things to happen. So tell us what's happening from the Verizon perspective.
Yeah, I appreciate it. There's been a ton of innovation, a ton of new connected medical devices being developed over the past few years. I think the big change I've seen is I really feel that I see IT leaning in a lot more with the clinical side of the healthcare systems to understand how this medical technology is going to evolve, and in the future, how IT can help enable these technologies. When you think about networks and bandwidth needed to operationalize technologies such as virtual reality or augmented reality, it really is a monumental shift from what was needed in the past. I also feel the IT departments fundamentally understand the benefits of edge computing and their capabilities, such as the lower latency and higher application availability, which maybe the clinical side might not have a great grasp of at this time. I think these technologies really open up many possibilities to improve care now, as well as limitless potential use cases in the future as technology manufacturers continue to innovate new technologies.
Yeah, I mean, it's you make a very good point about the IoT devices and the connected world out there, and every one of these has a sort of embedded technology inside of them that has to be connected. So I'm glad to see that Verizon has become a leader in this area and really helping to enable this environment. Nick Saki, we've got to store all this data, and there's a lot of data out there. Tell us how Pure Storage fits into this.
The joy of this panel is having the opportunity to talk about the end-to-end life cycle of data from the point of the patient all the way back to the infrastructure, and then how that data can be leveraged to improve clinician practice, patient outcomes, and of course, medical and follow-on research to support addressing everything from longstanding chronic healthcare issues all the way to current crisis, pandemic, epidemic management and tracking. But as my colleague Tom Long said from Verizon, there's a monumental amount of data out there. And in order to leverage it and manipulate it, it's got to be at the point of need, much like patient care. Data has to be processed throughout its life cycle. And what we build, of course, are the tools for manipulating that across the full spectrum of patient-centered and health-based outcomes and practices. So everything from virtual desktop infrastructure to electronic healthcare record management to telemedicine. And we've had obviously a tremendous year of growth across all of those practices. But what we're seeing is really, I wouldn't say revolutionary, but tremendous acceleration in the ability to take current data and make inferences and evaluations and assessments of everything from, obviously the flow and expansion and then subsequent treatment and changes in the COVID pandemic population, to a tremendous increase in the amount of telemedicine services that have been delivered all across the nation within the federal government, state and local governments, and of course, private practices, which has fundamentally transformed the availability of healthcare to remote and underserved populations as well. So these things all work hand in hand. At the end of the day, infrastructure is about making data available to improve outcomes. And we've been very proud to partner with government and private industry across the healthcare space in order to be able to make that happen. And we've seen just tremendous change, rapid change in the quality and effectiveness of the care and the speed to insight across the country.
And we're certainly delighted, I'm sure everybody is, to have this emerging technology available to make these solutions comprehensive and as effective as they are starting to become. Nicholas Spiess, how about at Snowflake? We have all this data now, we have to do something with it. Tell us how Snowflake fits into that ecosystem.
Yeah, thanks, Luke. Thanks very much, and thanks for having me. It all comes down to sort of what data is being used for and how it can be used by all the agencies and all of the wonderful initiatives that we've heard about for the last couple of minutes. The thing that I love most, Luke, is that everybody you talk to on the panel so far is talking about data and how they're going to use it and how they're going to share it. And that's something that 2 years ago, if this panel was held back in 2019, we would not have been having the conversation that way. There's less sources of truth, which is kind of counterintuitive, right? We should only have one, but there's less of those going around these days, which means we're building things where the data can move freely from one agency to another because we're doing things like setting standards or building better libraries for our data, but we're also putting better platforms in place where that data can move seamlessly, not just between agencies, but between clouds, between countries when needed. And that's going to make everything better, from treatment to research and development of new vaccines, of new cures, of new treatments, all the way down to individualized care. How much aspirin should you take, not based on your weight, but based on your genetic makeup? There's a lot of really exciting things that data is going to continue to do, whether it's the good captain over there with his artificial intelligence, or it's Lisa developing a better health record interface. This is going to be where we're going over the next few years, and I'm so excited to see it.
Fantastic. And speaking of the Captain Teta, let's talk about a specific program. We hear artificial intelligence in the medical community. I mean, that might actually make some people nervous. Is a computer, a machine going to do my diagnosis? And I think in some cases, the answer is they already is. But tell us about what's up at the Jake in regards to a specific program.
Yeah, let me highlight one specific program that's really important and really exciting. Our team right now, as we speak, are just engaging with our colleagues and partners in the Pacific Northwest. We just deployed what we call an artificial intelligence sort of application and solution at the point of care, thanks to the great work of all the folks that talked on the panel that really enabled this moment to come to fruition. So we delivered at both the VA and at the military treatment facility, Madigan, and the Puget Sound VA, an augmented reality microscope that has an interface that has a computer vision module in it that has been trained on algorithms to help detect cancer. And we deployed this with our pathology colleagues there and some members from the Jake team and our product management team, led by Captain Danielle Long Highland there. And what that represents, Luke, is something that seems like, wow, this is so futuristic. It's space age, because the pathologist can look into this microscope, put a slide in, and the interface will draw circles around the pathology and give them a clue into into whether the abnormality is. And as a cardiac surgeon, as a thoracic surgeon, one that works in cancer, you can imagine this is very exciting for us. Now, that may seem like, wow, okay, what's the big deal? We just had this, new technology, nice tool, little toy for the pathologist to play with. But what it represents is really the culmination of everything that everyone has just spoken about. That was 10 years in the making, to get the data, to curate the data, to work with our colleagues in pathology, to work with our colleagues in surgery, to understand and to get the correct sort of applications and algorithms in place, to plate them into a system and an interface that could actually use computer vision to identify the cells, and then to implement and deploy that. So it represents the tip of the iceberg, but a ton of work that underneath and underpinned all of that was data sharing, was the accumulation of curating that data, was making the data AI-able is one of the terms that one of my colleagues in the VA likes to use. So that really represents sort of a pioneering platform, and that's just one of many, and that's in the domain of warfighter readiness, that, as you can imagine, will have great application and utility in the future. And it brings to bear everything that everyone talked about, and it's bringing AI, the technology, at the point of care to help improve the diagnoses and improve the care that the providers are delivering to patients. One of the things I like to tout is the military is always led in these domains. If you think about vaccines, if you think about blood storage and blood banking, it's been the military. If you talk about electronic health records, the work that Mr. Tinston and Mr. Flanders are working on, it was the military that actually started, electronic health records in the very early, time of that technology. And now we're just advancing and being the vanguards again in this other domain and new frontier, so to speak. So that's just one of many very exciting projects, but I just wanted to highlight it because I think it represents really one of the sort of apogees of all the things that everyone's just talked about.
A fascinating case of a use case of AI being used in an environment that perhaps you wouldn't even think about. And you make a good point, two good points. One, that you're able to take that sort of from the petri dish and get it into a full operational environment. And boy, nobody does it like the DoD, to be able to take that and then be able to run it at scale, right? I mean, once it's sort of through the DoD gauntlet, it's ready for prime time. All right, we're going to take a short break and we'll be right back. You're listening to the Federal Executive Forum on Federal News Network. Welcome back to the Federal Executive Forum on Federal News Network. We're talking about healthcare IT and the federal service. And we're going over use cases. And Tom, I'm going to throw it over to you at Verizon. You're working with a lot of these agencies across the spectrum. Give us an example of a specific program you'd like to highlight for the audience.
Yeah, I appreciate it, Luke. There are so many different use cases that we've been working on with both the commercial and the federal healthcare systems over the past few years, whether that's the augmented reality solutions that we implemented within the VA innovation ecosystem, which allows the physician to actually look inside, virtually look inside a patient's body to identify where cancer may need to be removed, whether that's a 0 rating of the VA Video Connect application that we did over our network, so veterans can contact their physicians without using their data on their wireless devices. We've really been working closely with not only commercial, but also the VA with their connected healthcare department on telehealth devices and remote patient monitoring solutions. The one that is probably newest for us, so is as a company, we've bought a company called Blue Jeans, and we've developed that video conferencing platform into a telehealth platform. And we've integrated that into a lot of the common EHR systems that are available, that are being used out there in the space today. The cool thing about this is we actually created customer advisory boards, and we're taking feedback from customers in regards to how we can continue to evolve this application over time to meet the future needs of our customers and their patients.
I really love the idea of these video techniques. It's no longer the VTC standing over in the corner on the wall, right? It's really integrated, fused into the solution up the value chain. Really makes a big difference. Lisa, you know, we're talking about a lot of different pieces and parts of the ecosystem here, but it all starts with the North Star, as you pointed out at the beginning of the program, and these standards and the strategy that has to be put in place so that we're all pointed in the right direction. Give us a specific example of some of the activities that you all have laid, the tracks that you've laid down that have really helped to enable all this capability to happen.
Absolutely. Thank you, Luke. And I just first want to start by saying I take my hat off to my colleagues at VA and DoD and all the work that you all are doing. Is just amazing work. And as the granddaughter of a World War II veteran and the daughter of a Vietnam veteran, I just want to say thank you for the work that you are doing. As far as ONC, we really lay the infrastructure, as you've heard from my colleagues, we lay the infrastructure that allows the data to flow in a standards-based way. And so one specific example is our 21st Century Cures Interoperability Rule. And so as the provisions of that rule are starting to take effect, we're seeing a lot of what we have worked on for years, actually, to make this happen. So VA and DoD, the work that they are doing, that was from prior rules. What you are going to see in the future based on this rule is we require a standards-based, specifically FHIR-based, which is Fast Healthcare Interoperability Resources-based APIs, so that we don't have to build, 1,000 different APIs in order to interface with different electronic health records. We also put in provisions in regard to information blocking. So we outlined the exceptions because it is our position that a person's information should flow in a safe and secure manner to wherever they need it to flow and give permission for it to flow. And so in our rule, we also address information blocking, and specifically something that you may be seeing in your personal lives is faster test results. So a lot of you are probably starting to see notices from your doctors that say, you may get your test results, sooner, quicker. Just make sure that you are prepared to read your results. And we work to make sure information is available because we believe that information is power. It is the great equalizer. It allows us individually as patients, as caregivers, to be able to be active participants in our care. And so our rules have an impact, not just in the government space, but across industry and in our lives personally. And so we have considered that a great honor to be able to provide that infrastructure that the industry rides upon.
Well, everybody in this country, I'm sure, certainly on behalf of everyone in this country, thank you for that, because you're right. I mean, the results are coming in quicker. They're online, accessible, secure, and that's much appreciated. And I think it's very important for the health community and the community at large. Nicholas Spiess, let's talk about a specific program that you've been working on. I can't imagine there must be dozens of them that you've been working on across the community in regards to a good use case in respect to healthcare.
Yeah, thanks, Luke. we've had so many programs that have been made more successful by, again, the data collaboration and researching piece. But I want to focus specifically on the state of California's COVID response. In a very short period of time, COVID ramped up very, very quickly. And one of California's biggest concerns was not just where do we have the right materials to deal with this, but where is the spread actually occurring? What sort of activities are we seeing that folks will do that is more risk or less risk? And so they teamed up with Snowflake to build out an infrastructure that could very quickly respond and provide dashboarding for the governor and for a lot of the officials out in the state of California, but also could report that information up to the federal government, to the CDC, and to other states and counties. And the most important part of this, and the part that I like the most, because I keep talking about data collaboration, is their researchers in California were in a completely different cloud provider and a completely different area of the new infrastructure. So California had to be able to bring the data in locally to their cloud infrastructure because of contracting and procurement, but then also collaborate with somebody else on a completely different cloud, which in modern software as a service offerings like Snowflake, that's relatively simple and easy to do. So we were able to support the research as well as the response to COVID-19. We're very proud of that work.
Wow, sounds like a fantastic use case, and I'm glad to hear that, again, this plethora of data getting used in a very elegant way. Pat, let's go to you and talk about sort of the infrastructure piece of this. You said that you're involved with making sure that the networks there is reliable, secure, and available from just a high-speed capability. Give us a use case, if you will, a program that you'd like to highlight along those lines.
Sure. Yeah, there's dozens, and of course with COVID and mass telework, that was a real world test of was the new network going to work or not, and it did. But what I also
instantly, I might add,
yeah, but I also want to highlight some of the software we built. So we have something called the Military Health System Information Platform. And it is kind of the crown jewels of all data, all the medical data in the DoD. And, the way our agency was born, we had, an Army repository, a Navy repository, an Air Force repository, one that was in the National Capital Region. And this combined all of them, shut down those data centers. And as of June of last year, it is now in the cloud, technically at Amazon. And that all being in one place, under one roof, really enabled us to do wonderful things, tracking who had COVID, how it was spreading, and the vaccine distribution, those kinds of things. So that's something that really came out well. And it came out so well that as soon as it was done, I gave it to Mr. Tinston's folks, and now they run it. And it's going to endure as part of the EHR landscape.
That's fantastic. A great use case there. And again, I think a testament to having a modern environment and continuing to modernize so that you can scale when you need to scale, et cetera. I think everyone is thankful that this journey that they've all been on to get out of that technical debt has really been paying off. Nick Saki at Pure Storage. Let's talk about a specific use case that you'd like to highlight in regards to healthcare in the federal community.
Now, as we've discussed across this panel today, the volume and velocity of healthcare data has particularly accelerated throughout the pandemic. And what we answered the call for among our partners within the federal government and in private industry and across the state governments is how do we help them shorten the time to value on that data and maximize the amount of analytics and applications that they can apply against that data. So in particular, at the outbreak of the coronavirus, there was a tremendous spike in demand for analysis and sequencing of the virus itself. And we were able to partner with Health and Human Services and a couple of other agencies and companies to help increase the number of sequencing runs that they could perform per day, as well as do correlation and analysis of case data from across the country, and then helping to aggregate that data to produce the COVID dashboards. And we were doing this all off of literally a handful of different systems. But to bring that data together and to be able to serve it to a disparate group of application processes to help everybody from scientists and clinicians to policymakers have a unified view of that data, and to be able to adapt their views of that data as the data changed really accelerated the acceleration of decision-making and obviously insight and awareness to the nature of the disease and ultimately getting to a cure faster. So it's one of those things where we build probably the least visible thing on a car. We build the tires, but it's what enables the engine and the driver to be able to perform, tremendously well in the race that is for curing these tremendously difficult diseases. So these are lessons that we learned from obviously cancer research and other areas of biomedical sciences, and of course, our support for and partnership with Epic and with Cerner in terms of electronic health records. It's simply making the data move faster in larger quantities to enable faster time to insight and faster response to medical care requirements.
A great use case, and really, again, sort of moving away from having to wrestle with storing the data, enabling the data, transporting the data, and really focusing on using the data. In this case, a very important topic. It's a fantastic use case. Phil, how about speaking of the data, speaking of the records, you all, again, been on a great journey there, a lot of success. Give us a specific program that you'd like to highlight, an element of maybe the overall macro program that you're working on that you'd like to bring to the attention of everyone.
Oh, there's great stories being told, and I'll tell you, it's inspiring to me. I'm a defense acquisition guy by history and trade, but as my beard turns gray, so I love programs and I like to talk about the specific programs and program successes, because that's what you do in defense acquisition. You deliver a program, you manage cost, schedule, and performance, and you get stuff there. But as I turn gray, and as Nick brought automobiles into this, I'm going to give an example of what really excites me about what's happening in health IT and our support. I was at Costco the other day, and I was waiting in line to get fuel for my vehicle, like everyone else was, because there was a breakdown in a fuel supply chain system, right? And I watched the Bentley pull up, and it was actually a Bentley. There's a young lady in a Bentley, and I was thinking, wow, she's got to wait in line with everyone else because the problem is in the fuel supply chain, right? So generally, what our interface to the fuel supply chain as individuals is we go to the gas station with that's the most convenient, the lowest price, has the best fuel, whatever, and we go there, and we don't think about anything about the entire supply chain that gets that fuel to us, and that's right. And that's what I'm feeling and seeing and hearing in this group. Right, with the work that ONC is doing, with the work that the CIOs are doing, and the work that our industry partners are doing, we're getting all the capabilities here to make it about getting the data where it needs to be so that providers can deliver the right healthcare to patients and beneficiaries when they need to have it. So not talking about specific programs, not talking about specific use cases, just knowing that collectively, because we're all the IT people, right? We all do enterprise IT in some form or fashion, and we love to talk about it. But when the people we're supporting just know that they're going to have what they need, and they're not worried about the name of our program, they're not worried about MHS Genesis, they're not worried about what the Jake is doing, and then they just know that they're going to get that virtual microscope or whatever it was, that awesome use case you said. When all of this ties together, when we're not spending months and years building the interfaces, we just know that all of these pieces are going to result in an operating fuel station, an operating healthcare delivery system that people can enter, make choices about where they want to enter, and get the services they need and come out feeling better and get the record out of that. That's what excites me. And I know, Luke, you asked for a very specific use case. I just was so excited listening to everyone else's, because it all builds to this, frankly, magical use case. And I'll give this example. On the DoD side, building out and doing their deployments, there was a need for max vaccination capability, right? And as we deployed, I think it was 3 waves ago, they put this mass vaccination capability. It dropped vaccination times down to the floor. I think it cut them by 80% or something like that. It was initially used at Camp Pendleton with new recruits coming in. or actually it was, I think, units getting ready to deploy, not new recruits. But it also went to MCRD. And immediately that was turned around by the company that developed it with DoD to make sure to meet that DoD need. It's now part of a commercial product, and it's supporting the delivery of COVID vaccinations nationally, well, internationally, frankly. And that's the kind of standards-driven, infrastructure-driven transformation I'm seeing in health IT. We're now just talking about the capabilities, and we have providers and administrators of health systems that just expect us, the people on this call, to give them the capabilities they need. They don't want to hear about programs. They don't want to hear about IT. They want to hear about what they can do, and they want to know that they can make the best decisions they can make without going to talk to the IT people and asking if they can deliver healthcare the way they need to.
Right. Yeah, it's like a data scientist that doesn't have to spend all day wrestling with the data. They can just start using it. And speaking
Right.
of a use case, Captain, let me go over to you. You made a great point about the pathologist and you know, that they're sort of scraping that away, letting them focus on the issue so that they can put their mind on that, if you will. But tell us about the priorities. We're going to shift to priorities, and well, what do you got on your top 2 or 3 that you're trying to focus on this year?
Yes, I think we all have a great question. I think we all have priorities as a group here. I know one of them for us at the Joint Artificial Intelligence Center is to acquire talent because we are at a great need for getting talented people that share the passion of Mr. Tinston and Mr. Flanders to bring data and capability and source and of course AI to bear so that we can use it in the delivery of healthcare. One of our priorities, besides the talent, is to keep the human at the center of all of this. You started out the conversation appropriately so with the concern that folks can take AI and sort of have a dystopic view of what that means when it comes to healthcare. Well, our team at the Joint Artificial Intelligence Center recognizes that, and not to take away from any of those concerns, we have policy folks in place. We have ethical standards that we are applying to all of our projects and programs. And so we're keeping an eye and a sort of a North Star for us of keeping the human at the center of all of that. So I started out with that use case by telling you that the pathologists were at the center of that. We were just simply, as Mr. Tinston said, just supporting. We're giving the tools, the data, and the equipment and the technology to help them do their jobs better, helping to have the healthcare provider leverage technology and data to do their jobs better. So always having the human at the center, at the intersection of where data and technology, people and work come together, that's really what we're doing. So as we deploy all of these great and novel capabilities, we know that it'll take the people that are actually using the solution to really be the vanguards for how this gets rolled out. Just to give you a very quick anecdote, but one that's very appropriate to the times that we're living in, and it sort of exemplifies what our priorities are, and that is to accelerate the adoption of this technology. So Rene Laennec, you guys may not know who he is, but those of us in healthcare know that he's the person that invented the stethoscope. Now you see stethoscopes, they're ubiquitous, they're all over the place. Everyone's probably seen one and probably played with one as a child, and your doctors used it on you. Well, he developed that thing back in the 1800s. It took 30 years for people to adopt it widespread because they just didn't understand it. They didn't really, appreciate what it could do. They didn't understand how it could enhance the diagnostic capabilities of a practitioner using this funny looking thing. Well, we don't want that to 30 years to go by before the rest of the pathologists in the community start using this kind of technology. We want to accelerate the adoption. And so kind of going back to those principles that General Groen has sort of laid out for us, accelerate the adoption of AI at scale and delivering these enterprise services with the help of all of our partners here. Is really what we're about. That's definitely one of our priorities. Keeping the human at the center, looking for talent, and accelerating adoption of AI. Those are really our priorities.
3 very important ones, and we really do appreciate that. We're going to take a short break, and we'll be back in a moment. You're listening to the Federal Executive Forum on Federal News Network. Welcome back to the Federal Executive Forum on Federal News Network. We're talking about healthcare IT in the federal service, and we're going over priorities right now. And I'm going to toss it over to you, Lisa. And you talked about a lot of different efforts, a lot of different activities going on over there. Give us your top 2 or 3 priorities for this year that you all are working on.
Well, thank you for the question, Luke. Of course, our priority continues to be interoperability and patient empowerment. I also want to note, though, that we are working diligently on the administration's priorities. COVID response and recovery, of course, continues to be a priority for us. I want to give my condolences to anyone who has lost loved ones during this pandemic and/or has been adversely affected in any way with your own health. You have my condolences, and thank you to all of our healthcare workers who have been working for over a year diligently, and all of the first line essential workers as well. As far as our work in regard to COVID response and recovery, we are, as you know, responsible for making sure information flows, and we have recognized that we need to do more in regard to ensuring information is flowing from the public health agencies to clinicians and from clinicians to public health agencies. So that cycle is going to be an area of focus for us, making sure that that data moves and that everyone has what they need at the point of care, especially to ensure that if another pandemic occurs, and some people say that it's not if, but when, that we are better positioned from an information sharing perspective. We also are working on equity. And my boss, our national coordinator, Dr. Mickey Trapassi, talks about equity by design. And so we really are looking to ensure equity in every aspect of the policies and programs that we influence and that we implement. We are looking at equity not just from the perspective of the healthcare system itself, but still for all of the trillions of dollars that we put into healthcare, the biggest determinant of someone's health and life expectancy is still their zip code. So we have to look at social determinants of health. So we are looking at that as an area of focus as well. And we continue to just push forward for standards-based approaches to health information technology in every area.
So important to this overall program. Pat, how about at your agency there? What's your priorities for this year?
So Genesis, obviously, and everything associated with that is first and foremost.
Absolutely.
However, I have 2 other things. So back to the way we were born, right? Army, Navy, and Air Force treatment facilities, each with different ways for how they bought technical support services. So technical skilled labor, those kinds of things. So overall, there's about 200 individual contracts out there for that purpose. We are replacing those 200 contracts with about a dozen. And the first is in source selection right now. So it's the MHS Enterprise IT Services contract. That first contract's very important. It will replace 6 contracts that are run out of my headquarters, and it will help us with award of the follow-on contracts. So a lot going on there. And the second is we run a 350 person global help desk that the sun never sets on. It's the number you call when you have a problem wherever you are in the world. The software that we used to run that, we're replacing. The go live for that is this coming Friday over the holiday weekend. And that's a really big thing. It will affect every single treatment facility in the Department of Defense. So that's a huge priority.
Fantastic, and real important to lay those contracts down so that you can execute cleanly. Bill, how about at electronic health records? Top priority for you this year?
Well, I'm gonna give you a couple.
Sure.
So when I talk to my team, we talk about operationalization and we talk about convergence. So those are fine words, but what do they mean to us at the firm and what we're trying to accomplish? From the operationalization perspective, I mentioned up front, the firm is here to be to bring together the work of the VA and the DoD on a single common federal health record. But you can't have 3 operators of that federal health record. You need you asked me about programs before, you effectively need a program manager, an operator, to bring all the pieces together and make sure that we effectively deliver that to those two departments, the U.S. Coast Guard, who is already using it, and potentially other healthcare providers in the federal healthcare enterprise. You know, we've had conversations with NOAA, we've had conversations with NSA, we've had conversations with the Indian Health Service, and I don't know if those will come to fruition, but I think we're poised as a firm and as a federal enterprise to offer capabilities that to smaller healthcare providers in the federal space that they probably couldn't afford, because DoD and VA have borne the upfront costs of creating this tremendous capability. So pushing that forward, being the single operator, pushing that forward, continuing to drive this is the convergence piece, the convergence between the DoD, the VA, and the Coast Guard from a functional and a technical perspective, so that we can make sure that we simplify and simplify the operations of the IT that supports the healthcare delivery, but also create as much commonality in the healthcare delivery side so that they're interoperable from a process perspective, as much as appropriate for those health systems. And I'm not a physician or a doctor or a healthcare provider in any way. I don't want to make those decisions. I want to enable them to make those decisions by taking the IT out of their decision loop. And the real priority, and I think kind of a demonstration or a prototype for much of this from a firm perspective, is the implementation and the planning for the implementation of the Federal Healthcare Center at the James A. Lovell Healthcare Center, which is a joint VA DoD facility in North Chicago. Getting that right, getting a synchronous deployment there, and the firm is leading that. I think that will be a prototype for what is possible from an health IT perspective to support integrated operations of two massive healthcare systems. And that's a huge priority for us in this upcoming year.
That sounds outstanding. Okay, well, we're going to wrap it up with this last question that we always like to ask, and I'm going to start with you, Nicholas. And it's about, what does the future look like? What's the demand signal that you're getting as an entity? What do you think the environment looks like 2 or 3 years from now?
Well, thanks, Luke. And I'll tell you, I think there's going to be a lot more gasoline flowing into Bill Tinston's data healthcare IT Bentley. I think that's really where we're trying to head to. And I think, during the last time we've been here, we've heard from several experts, the great things that are going on in the industry. We're going to see more of, to Tom's point, edge computing and edge processing. That stuff will be done in data centers closest to where the data is because of the sheer volume of those things. And then I think we'll also see collaboration on a global scale as well. I think that's what I'm most excited about. I love seeing the data derived from all of the diagnostics information and using that data to build better AI tools like the Captain Ted is building out. I think all of that is going to start really developing a lot of steam over the next, say, 12 to 24 months, especially as we come victorious from COVID. That is what I'm most excited about, just seeing the data get where it needs to go for not only diagnostics, but also treatment and making our lives better.
Again, meeting the patient where they are. I love that. Nick Saki at Pure Storage. What's the future look like from where your vantage point is?
Well, and extending the comments of my estimable colleague, Nicholas Spiess, we're going to see a tremendous increase in the scale of computing and scale of data growth, even greater capacity than we have in the recent past. And it's going to drive change in the tools that are used for research, diagnostics, care, and management. It's also going to drive the adoption of infrastructure for on-premises and cloud infrastructure, as well as the interoperability of that data. As Lisa Lewis-Person said, we've got to have a way for disparate agencies to be able to address disparate data sources and leverage them for insight. So that's going to fundamentally transform the underlying infrastructure and the software tools that we use to create that seamless movement of data and management of data across multiple enterprises. So we look to see a tremendous increase in the adoption of Kubernetes as an example, DevOps and DevSecOps, and those modalities of computing that facilitate that cross-cloud and cross-infrastructure movement and availability of data. And lastly, we're going to see a tremendous, the mainstream adoption of artificial intelligence and machine learning. And just as a point of reference, it was thought impossible a year ago that we would have vaccines or even a vaccine for the coronavirus. But when you take a look at the 20 to 30 years of research in virology, the tremendous amount of data that's available, and you add to that the capabilities of artificial intelligence today to help us start analyzing and understanding those things, we may have just broken through in terms of the methodology and means by which to start addressing current and future pandemics and even predict the evolution of this current virus. So all of those things are really driven by data availability, bandwidth, processing, and we see that we're going to see, to Nicholas's point, a fundamental change in the way we think about data management, data availability, and data processing as the idea between cloud and on-premises become blurred by virtue of 5G, artificial intelligence, and tremendously more powerful data processing components and compute networking and storage.
It's all fusing together. Thomas, how about at Verizon? You all are continuing trying to stay in front of these huge demand. What's it look like in a couple of years?
Yeah, so when I think about the future, I not only think about the connected healthcare devices that aren't widely deployed or even invented at this point, but I really think about what's the enabler of that. And the enabler is the network of the future. Those networks are really going to help connect everything. When I think about those, it's really a symbiotic relationship between a terrestrial fiber-based LAN network coupled with maybe a private 5G network overlay, including software-defined networking, edge computing, throw on top of that artificial intelligence software, and you've really built a network that's going to enable the future. These type of networks are really critical to enabling technologies such as smart campus, smart building solutions, hyper-precise location services, and it also gives the advantage of incredible speed of deployment of future technologies as they become available. Imagine arriving at a medical center, you enter the parking lot, and I've been to a lot of medical centers, and sometimes it's very hard to find a parking space, and you've got a smart board, which, you get a smart parking solution that helps you find a space. You pull up, you get in your space, all of a sudden an autonomous shuttle comes and ferries you to the building on campus that you're trying to get to. You walk into the medical center, an application on your smartphone acknowledges that you've arrived, it checks you in, it provides a wayfinding solution to help you find your way throughout the medical center. All of these things are going to be able to be put in place with hyper-precise location services, and it's going to require the network to do that. With the evolutions of these technologies, it's really going to allow medical centers to have sub-centimeter accuracy in regards to where things are on site, whether that's a patient, autonomous meal delivery robot, a piece of medical equipment, or even whether something has gone through the sanitation process or not. When you couple this with artificial intelligence, it really has the ability to improve patient care and allow healthcare systems to work more efficiently.
Wow, you really have painted a picture of the future. And Bill, you've been talking a lot about sort of what the overlay looks like. What can we expect in a couple of years?
So you originally asked this as lessons learned, and here's what I heard from Hassan was talking about having the pathologist in the middle of designing the solutions and supporting that process. I think what I hear here, and it's exciting to hear, is this shift from people who are managing IT, and we have to manage IT. There's no question about that. That's our jobs. Manage the capabilities, get the capabilities integrated, follow the standards that ONC helps us with, get the infrastructure in place that Pat helps us with, get the tools in place that all of you do. All of you help create. But what we really have to do is remember, and we learned this in the EHR, that we're supporting people. It's not even just human-centered design, right? You hear that, but you're supporting people. So you give them new workflows. And I've heard Mr. Flanders talk about this. I've talked about this. What went wrong when DoD first delivered the EHR? Well, one of the stories is we went out and taught people how to use a tool. What we're doing is we're changing their jobs. You have to think about what you're doing to people all the time. I think that is the number one lesson out of all of this is what are you doing to people and how do you help support those people and what are their expectations from you? This is another people element. So when you're delivering new capabilities, there's this tendency, and there's my entire professional lifetime tendency on the IT side for people to never feel like they're done or it's good enough. And the reason I believe that they come to that conclusion is it's like having construction done on your house. You don't want to let that contractor go until it's perfect. So you're gonna hit the checklist. You're gonna go over it 8 times. You're gonna bring family in to help look for nail pops with you. But in fact, if you set a different expectation with the people you're supporting, and we heard that, we heard CI/CD, we heard DevSecOps, we heard things that improve the speed to delivery and the connection to relevance. If you create an expectation that this is going to improve every day from here forward, you're not going to have me coming in doing a massive replacement of your system again, because every partner on here is going to help drive continuous improvement in this space. And so you're going to get more. Then they accept it, they embrace it, and then we can move forward. And then the other huge insight that I've picked up, and truly this was, you guys are all smarter than me. This was a huge insight for me, and everyone talked about it today. If we go back to that automobile and that fuel supply chain analogy, we're really supporting a medical data supply chain here. And we all recognize that. We're getting the right transport in place. We're getting the right analytics in place to look at it. We're making sure, Nicholas talked about, there are fewer sources of truth, and we're getting to a source of truth, be that a federated source of truth or not, so that we can all look at the same data, or the right people can look at the same data, understand what that data, and maybe glean different insights, but not argue about what the right data is, because we have a source of truth. And then we got, Hassan creating new sources of data through the microscope. I mean, tying all of this together is just transformative for how people do their jobs. And we need to focus on the people doing their jobs. And remember, that's why we do IT. I may do it because I think it's cool, but that's not why people give me money to do it. People give me money to do it because they're trying to support patients in healthcare delivery.
Job one is to keep the patient in mind. Great outline there. Captain, what does the future look like for the Jake? I'm sure you all are cooking up a lot of things in the Petri dish there.
We are, and you can find out a lot more just coming up in a couple of weeks. We're actually going to be hosting a DoD AI symposium, June 22nd to 23rd, so you can find out all the great things that we're doing there. But Mr. Tinston's passion and Mr. Flanders, both of the Nicks and Tom, you all have reminded me that it's so important to kind of reflect on the past, especially when you're going to answer a question about the vision for the future. So I'll just make this a mention, and Lisa Lewis will certainly appreciate this. One of my mentors almost over a decade ago was the first O&C director when they stood that office up. And he wasn't a tech person, he was a physician, and he said, I'm coming here to help give information and technology to help people do their jobs better. And that resonated with me so much, because years before that, I wrote a thesis on what's wrong with Alta and Vista. And here we are, and there's someone on the line that is actually talking about putting an interoperable, unified electronic health record, deploying it for both the VA and the DoD. I mean, that was virtually impossible when I wrote that paper. And here we are talking about these amazing things. I just can't help but think that the future is, Luke, very, very bright, very bright. I think so bright, we should all be wearing sunshades right now. And what we're going to be all doing here is, I think, bringing technology, data, and bringing those things to the people to help them do their work better. That's exactly what we're going to be doing. That's the vision for the future that I see. So
wow, great context there, pulling in that history with Alta and Vista. Pat, how about over at the health agency? What's it going to look like in a couple of years? You're going to have your contracts in place. You're going to have some of these tracks laid down. You're going to have your help desk all running perfectly. What's next? What's it look like?
Right. So, we're building the skyscraper from the bottom up.
Sure.
And so what we'll have is the key enablers will be in place. The network will be there. The electronic health record will be fully fielded, right? And now we capitalize on that investment, right? So we integrate capabilities that couldn't be integrated before because everything was distributed. Things like, a virtual video visit integrated with the EHR, or a telecritical care integrated with the EHR, and all this equipment now integrated, connected to the EHR that we couldn't connect before. And then, real utopia is that day when the first military person retires, and all you have to do in the EHR is click the button that says retired. There's no paperwork movement. There's nothing like we have today.
The ultimate easy button. Lisa, take us home. Paint a picture of the future. You sort of have been working on the future. What's it look like out there in a couple of years?
So for us, we see the future very much as all my colleagues have said. It's what they've all talked about really is the true transformation of how healthcare is delivered. And it's a transformation similar to what we saw through technology in the transportation industry, in the financial industry, and one of my favorites in how we shop. Technology has changed so much of what we do. That is what is happening in healthcare. And in the future, we will see that come to fruition, where we have true interoperability, where we have true exchange and use of data. So our health information is where it needs to be whenever it needs to be there because of FHIR-based standards and because we don't have information blocking. We will be able to have a healthcare delivery system that works for everyone exactly as it should.
Thank you very much. Fascinating show today. And I'd like to thank all of our guests for taking the time out of their busy schedules to join us for this program. And thank all of you for your federal service, all the front line workers, all the healthcare workers that have been fighting the good fight over this, this tumultuous year and change. I'd also like to thank the sponsors here for supporting us on the show. I'd like to thank the good people here at Federal News Network that make our program so successful and enjoyable. And most of all, I'd like to thank you, the listening audience out there that tune in every month. You've been listening to the Federal Executive Forum, part of the Federal News Network.